Obsessive Compulsive Disorder, also known as OCD, is a chronic mental health condition. OCD is comprised of two different things. Obsessions, which are unwanted intrusive thoughts. These are not thoughts that we get pleasure from. These are not thoughts that we enjoy. And it's followed by compulsions, which are repetitive rituals. Everybody in this world has obsessions and everybody has compulsions, right? We all do little things here and there. But the really important part about OCD is the D part, which is the disorder. When does it become a disorder? When is it something we should really start to seek treatment for? My brother-in-law grew up in Austin and is an avid UT football fan, right? He obsessively follows the University of Texas, looks at stats. He certainly watches, the games, and he's a bit obsessive about UT football. He has compulsions as well, right? He watches the games, he goes to the games, and he engages in compulsions around this activity. The difference is he enjoys it, right? It doesn't cause him disturbance or disruption. There's not a disorder component, even though there's some obsessiveness or obsessions and some compulsions or rituals or behaviors, right? OCD is unwanted intrusive thoughts. We don't enjoy it. Repetitive rituals that we do in an effort to get rid of that unwanted intrusive thought or that obsession. And so that's what makes up the disorder. It's often characterized by more than an hour of disturbance a day. But the thing I'll say at the end of the day is we diagnose OCD when it's starting to interfere with your ability to function normally. That's when it becomes a disorder. If it's affecting your social relationships, your school life, your work life, your family life, your eating, your sleeping, right? That's when you want to seek treatment. There's never a time where you're seeking treatment too early or prematurely, and there's never a time where we would say, don't get evaluated. It's up to a therapist to kind of really tell you if there's a diagnosis there. But the disorder part is really important. A lot of times society forgets about that. They think people who engage in some compulsive behaviors of maybe ordering or arranging, oh, they have OCD, and we've started to label that as OCD, so-and-so so OCD or that's OCD. That's not what OCD is. OCD is unwanted intrusive thoughts, repetitive rituals that cause disturbance and distress, which is why it makes up a disorder.